I'm Claudine Wong, joining you from the San Francisco Bay Area from KTVU, and we're talking about a new study that was just done by UCSF Benioff Children's Hospital. Very interesting results when we talk about the people that are affected by COVID-19. We have Dr. Sally Adams, who's a PhD. She's the first author of the study. Dr. Charles Irwin joining us as well, who is the senior author. They are both with the UCSF Division of Adolescent and Young Adult Medicine. Thank you both for joining us. So let's talk about this study, because it really focuses on this group that really, I think, has felt a little bit protected in this COVID world in terms of how much they're impacted. But certainly as we're seeing it progress over the many months, Dr. Adams, can you talk about what really the focus of this study was and what questions you were trying to answer?
Yeah, thank you. At the beginning of the pandemic, there was very little data on health and risk factors for anyone, and very little data that was put out there grouped young adults with either all adults or with younger adults, which were like about 20 to 44-year-olds. Our age group is actually young adults aged 18 to 25, and they have very different patterns of activities, behaviors, healthcare needs, and that kind of thing. So we thought it would be valuable to the research and the clinical community to try to get some kind of sense of the vulnerability of that specific age group on issues about the likelihood of having a more severe case of COVID. The CDC emphasizes that everyone is at risk for COVID, but people with certain conditions or behavior patterns might be at greater risk. And so we wanted to investigate that in our young adult population.
And that's really important, I think, in terms of just figuring out how we all do something differently, or who is most at risk. I mean, we always talk about the 65 and older group, and we know different ethnicities. Dr. Irwin, if you want to just weigh in on the clinician side of that, it really isn't just about answering questions, but actually giving directives when you can say, hey, we do have information and data as you're going to your doctor and asking, where am I in this big picture? It's been a complicated kind of situation for the medical side of this.
Well, I think that we as physicians in the public health community and our political leadership has really not given consistent messages to young people or to any age group in particular. I think it's emphasized giving information to the elderly, but there has been no real direct information. Also, what one has to realize is that young adults very rarely come into clinicians' offices. In fact, they have one of the lowest utilization rates in the country. They don't have a usual source of care. They generally don't come in for well care. So it's really important when we have an opportunity that they come into the clinical encounter that we have information that's correct, honest, and related to that age group.
Yeah, I think that's really a challenge, because you're right, the messaging has changed as we've learned everything, right? We say, okay, here's this and here's that. So let's get to the results of this study. As you're looking at it, Dr. Adams, you were looking at smokers and non-smokers, because certainly when you're talking about that age group, and I imagine we can include vaping in that category, right? If you use electronic cigarettes, it counts as well.
Yes, that's true. We were interested in the whole group of young adults, and most of the risk indicators include chronic conditions like heart disease, lung disease, obesity, immune problems, and other kinds of things that young adults typically have low rates of. And so we were sort of surprised, but we felt it was important to include smoking factors, because we know that they impact immune strength and respiratory health, which is one of the obvious targets of the COVID infection. So we were quite surprised to find out that 1 in 3 of the young adults has vulnerability towards a more serious form of the illness, of COVID illness. But if you just look at non-smokers, only 1 in 6 has the vulnerability. And so it really emphasizes the important influence on the number of young adults that may be impacted to be susceptible to more severe COVID.
Right. I'm going to pull up this graphic that you guys have put out to really kind of give people a sense of what this really means. So you've got the smokers and the non-smokers, and then you have just the non-smokers. And when you're looking at vulnerability, I mean, there's vulnerability to all of us, whether we smoke or not. But if we're trying to figure out how we can protect ourselves maybe a little bit more, I would think as a layperson that this is a pretty dramatic difference.
Yes,
that's pretty clear. I think it's pretty clear. This graph tells the whole story in the sense that, you know, if you're smokers in the smoking group, you have a 1 in 3 risk, versus in the non-smoker group, you reduce your risk by half. I don't know of many interventions that we have in medicine or public health that reduce something by 50%. So I think that's the clear message.
Yeah, I mean, is there, you know, when you're going to talk to young people, is there anything in the study that gave us an indication of saying, okay, if you are a smoker right now, or you vape or do electronic cigarettes right now and you stop, like going back to if you're a young person calling your doctor or trying to find a doctor now if you don't have one, because I think a lot of young people don't even have doctors that they see, you know, does that protect me more?
I think that question we haven't answered in this study.
Yeah, and
you know that, yeah.
We lost your picture for a quick second, Dr. Irwin. There, you're back. Okay, and go ahead and finish your thought.
Yeah, so I think we don't ask that question in this study because we're really not looking at individuals per se. We're looking at data that is a cohort data that we're looking at. But I think what is interesting, if you there's a lot of indications whenever you stop smoking or if you diminish the amount of smoking, you have benefits from that. Mm-hmm. So I think for us, the message right now is how can we give clear, direct messages to young people who may be at greater risk if they're smoking.
Right, and have that be backed by actual numbers and that was a very clear graph to me when I saw it of saying, you know, where do you want to be in terms of lowering your percentage? You know, Dr. Adams, you talked about surprises. Were there other surprises in this study when you're taking a look at it and things that, you know, it does make sense to me just, you know, in a common sense way of anything that affects your breathing in a disease that affects, you know, our lungs and things like that would be, you know, a very, you know, big risk factor. Were there any other surprises for you?
Well, there was one interesting finding that I think is worth mentioning, and that is when you look at the full sample of both smokers and non-smokers together, actually what you do see is that individuals in lower income settings and individuals who have less or no insurance have higher smoking rates. So when you look at the whole sample, you see that those individuals have higher vulnerability. However, when you just look at non-smokers, you do not see a difference by income and by insurance status, which indicates even more strongly that the smoking factor is what is conferring the vulnerability to the young adult age group.
Oh, that's interesting. And does it open the door then to other studies saying, you know, usually, you know, you go down one rabbit hole and you find another one and you're saying we really need to study this next because here's something we found and here's what we need to know?
Well, on the one hand, we don't have great data on personal behavior factors with people who actually develop COVID and more serious degrees of COVID. And so that is kind of needed. It would help really validate what are the actual factors, because at this point we are working with potential factors for this age group. And again, the age group's very different from older adults who have more chronic illness and are more highly likely to have more chronic illness.
Yeah, and Dr. Irwin, as we talk about the messaging and go back to that discussion, because it's been so hard. I mean, you can get these results and then getting it out there to all the providers and saying, I don't know if any doctor is telling, any of their patients that smoking is good or vaping is good. So that messaging is already out there, but having that understanding that, this is now giving you an added reason maybe to stop or not start or stay away or cut back, or, how difficult is this to get, and how important is it to get some of these study results out to doctors and who are talking to their young patients?
I think there's an assumption right now that appears to be out there in the media that young people don't care about their health. They're putting themselves in situations that put themselves at more risk. And if you think about this, young adults, the idea that we're going to take young adults and tell them not to interact with other individuals, not to talk with their friends, be with their friends, is almost developmentally inconsistent with this group. And I think what we fail to realize that there are, we in a sense blame them for their behavior, but they've been shut down and in place for several weeks or several months now, because that was the messaging that was going out to them. I think now is a time that we have to be a little bit different and really say, okay, we understand they may be engaging in situations that we don't think are healthy. We need to give that message to them, number one. And number two, we have an added clear message to say to them that you have every reason now to try to cut down on your smoking or not initiate smoking. And I think clear, direct messages from public health individuals and clinicians can make a difference in young people's lives.
Now, I know that you guys focused on 18 to 25, right? And those were the main groups of young people. But it occurred to me as well as the debate rages on about schools and going back into schools. 18 to 25 hits our college age kids who are trying to figure out if they can stay in dorms or fraternities and sororities or things like that and go on campus. But when you bring up smoking and vaping, I also think about the middle schoolers and high schoolers who are maybe doing those things and their parents don't realize it or don't realize that, because every time I've done a story on vaping, that does come up. Is there a thought that maybe there needs to be a study? Because certainly as we go back to school and those kids who are seemingly healthy, but engaging in a behavior that may put them at more risk, it seems like maybe more information is relevant there, because I don't know if this study can address that. I don't know if Dr. Adams, you can maybe address that.
I can say a few things. One is anyone who smokes or vapes, the effect of that is lung changes, lung tissue changes, and immune strength changes. So this finding isn't just about young adults, but that was our sample. And there's more now that is talking about smoking and COVID severity among all ages. And yes, of course, adolescents of any age need these messages. We found that in the past, adolescents used to initiate smoking and more than young adults, for instance. And if you could stop them or prevent them from starting to smoke when they were adolescents, they were less likely to ever smoke. But now we see that young adults have been more likely to initiate smoking than adolescents. But nevertheless, it's all important for all age groups, and particularly adolescents, because it's difficult to stop smoking.
Yes, it is. Once you start, I think people, I know people have trouble. Yeah, Dr. Irwin, go ahead.
I would like to add something. The slope of the curve of electronic nicotine devices and vaping, if you look at that, the curve from say 12 years old to 25-year-old, the slope of the curve, it starts slowly at 12, 13-year-olds, but the slope of the curve is very, very steep. And therefore, and also fewer adolescents are now smoking cigarettes than ever in the past. So actually, teenagers have got the message that smoking cigarettes is bad. What we haven't given them is the same message. The electronic nicotine devices put you at the same risk in many ways. So I think the messaging, we can take the data from this study and still message it to adolescents. We don't have specific data that speak to what the risk is because we don't have an age group like that to study in these analyses. But it still is a very good message to be given to adolescents. And adolescents actually see physicians more often than young adults do. So in some ways, it's better if the clinician would have more opportunities with the adolescent age group.
Well, I would imagine that, they still have to go to their pediatricians, even in high school, see if they want to play sports or do anything like that. And I think even for coaches and anyone who is reaching out and talking to these people, these young people, certainly getting that across to them in a way that makes them hear that, it's their health and safety as well. And certainly more information is always better. Well, Dr. Irwin and Dr. Adams, I appreciate it. Certainly the study has been very interesting for me to read, and I think all the information that we can get on how to better protect ourselves against COVID while we cross our fingers for a vaccine and hope that comes sooner than later certainly helps us all. So I appreciate both your times, Dr. Sally Adams and Dr. Charles Irwin with the UCSF Division of Adolescent and Young Adult Medicine at UCSF Benioff Children's Hospital in San Francisco. Thank you very much. And of course, if you want more interviews, you can go to coronavirusnow.com. Thanks so much.